Welcome to this video about the Spanish flu, a forgotten pandemic that ravaged the world in the early 20th century. In this journey, we will delve into the origins, impact, medical understanding, and societal response to the Spanish flu. The year was 1918. World War I was at its peak, and humanity was engulfed in the chaos and devastation of global conflict. Amidst the battles and geopolitical tensions, an unseen enemy began to emerge, an enemy that would soon surpass the war's toll on human lives. This enemy was the Spanish flu, a virulent influenza outbreak that would leave an indelible mark on history. Contrary to its name, the Spanish flu did not originate in Spain. The misnomer can be attributed to the fact that Spain, being neutral during World War I, had a more transparent reporting of the outbreak compared to other countries. The true origins of the flu remain elusive, with some theories suggesting it may have emerged in France, the United States, or even China. The Spanish flu made its first appearance in the spring of 1918. Initially, the outbreak seemed to be a typical influenza season, causing mild symptoms in its victims. However, it soon took a dark turn. By the summer of 1918, the virus had undergone a drastic mutation, resulting in a highly contagious and deadly strain. The flu swiftly spread across the globe, aided by the movement of troops and massive population displacements due to the war. The close living quarters in military camps and troop movements played a significant role in accelerating the virus's transmission. The symptoms of the Spanish flu were alarming and severe. Victims experienced high fever, extreme fatigue, and respiratory distress. In some cases, the flu progressed rapidly to severe pneumonia, often leading to death within a few days. What was particularly concerning was the virus's tendency to target young, healthy adults, those with strong immune systems, causing an unusually high number of fatalities in this demographic. The impact of the Spanish flu was devastating. An estimated 500 million people, or about 1/3 of the world's population, were infected. The death toll was staggering, with an estimated 50 million lives lost worldwide. Families were torn apart, communities were shattered, and the world was left grappling with the aftermath of this unprecedented health crisis. The causative agent of the Spanish flu was the honeknown influenza, a virus, a subtype of influenza A. What made this strain particularly lethal was its ability to affect and fatally damage the lungs, causing severe pneumonia. Additionally, the virus had a rapid transmission rate due to its highly contagious nature, spreading through respiratory droplets expelled when an infected person coughed or sneezed. The 1918 honeknown strain had a unique ability to trigger an excessive immune response in the body. In many cases, the immune system's reaction was so intense that it led to a condition known as a cytokine storm, where the body's own immune response caused severe inflammation and damage to healthy tissues, especially in the lungs. This phenomenon was a major contributor to the high mortality rates observed during the Spanish flu pandemic. The early 20th century lacked the medical advancements and knowledge that we have today. Medical professionals at the time were limited in their understanding of viruses, how they spread, and how to effectively treat them. Antibiotics, antiviral medications, and vaccines were non-existent, leaving medical professionals with little more than supportive care measures. Due to the lack of medical advancements, treatment for the Spanish flu was primarily supportive. This included bed rest, good nutrition, and isolation to prevent the spread of the virus. Various remedies and therapies were attempted, but their effectiveness was questionable. Hospitals were overwhelmed, and healthcare workers were stretched thin, trying to manage the influx of patients. In an attempt to control the spread of the flu, public health measures were implemented. These measures included quarantine, isolation, good personal hygiene, use of disinfectants, limitations on public gatherings, and the wearing of masks. While these measures were somewhat effective, The lack of understanding of the virus and its transmission limited their overall impact. The Spanish flu pandemic had a profound impact on societies worldwide. Beyond the immediate loss of life, communities were overwhelmed with grief and loss, leaving a scar that lasted for generations. Families were torn apart, and the effects were felt in every corner of the world, from bustling cities to remote villages. The sudden and widespread nature of the disease meant that no one was left untouched. The loss of a significant portion of the young, healthy population had lasting effects on social structures, economies, and family dynamics. The trauma and grief experienced during this time had a ripple effect on mental health, shaping how societies approached healthcare and well-being in the years that followed. The Spanish flu pandemic also had a severe economic impact. During the pandemic, businesses suffered as a result of widespread illness, absenteeism, and loss of workforce. The disruption to trade, commerce, and daily life contributed to economic downturns in various countries. The costs associated with healthcare, burial, and lost productivity were substantial. Additionally, the war had already drained many economies, and the pandemic further strained resources. Governments struggled to respond effectively to both the war effort and the healthcare needs of their populations. The pandemic's economic aftermath was felt for years, influencing economic policies and strategies to prevent similar crises in the future. The Spanish flu served as a catalyst for improvements in public health infrastructure and research. The devastating impact of the pandemic prompted a reevaluation of healthcare systems, disease surveillance, and the need for international collaboration in health matters. The experience underscored the importance of a coordinated global response to emerging infectious diseases. Many lessons were learned from the Spanish flu pandemic, including the significance of early detection, effective communication, and rapid deployment of medical resources. The event set the stage for advancements in the field of virology, leading to the development of influenza vaccines and antiviral medications, aiming to mitigate the impact of future influenza outbreaks. The legacy of the Spanish flu pandemic endured in the collective memory of humanity. It left a lasting mark on medical practices, public health strategies, and global responses to pandemics. The events of 1918, 1919, 1919 highlighted the need for preparedness, research, and international cooperation in the face of emerging health threats. The Spanish flu remains a haunting reminder of the potential devastation of infectious diseases. In the modern era, with global travel and interconnectedness at an all-time high, the threat of a pandemic is ever present. The COVID-19 pandemic has showcased the impact a novel virus can have on societies, economies, and healthcare systems. The lessons from the Spanish flu are as pertinent today as they were a century ago. The Spanish flu emphasized the critical importance of preparedness and global cooperation. Nations need to work together, share information transparently, and mobilize resources swiftly to combat emerging infectious diseases. Collaborative efforts in research, vaccine development, and treatment strategies are essential to effectively respond to and mitigate the impact of pandemics. Investments in robust healthcare infrastructure are crucial. Sufficient healthcare resources, including medical personnel, hospital facilities, and medical supplies, are vital to respond effectively during a health crisis. Building resilience within healthcare systems to accommodate surges in patient numbers and adapt to evolving situations is paramount. Education and communication play a crucial role in managing a pandemic. Clear, accurate, and timely information disseminated to the public helps in shaping behaviors, fostering compliance with public health measures, and mitigating panic. Transparent communication from trusted sources is vital to combat misinformation and ensure public trust. The Spanish flu highlights the critical importance of rapid vaccine development and equitable distribution. Advances in vaccine technology, along with streamlined approval processes, enable faster development and deployment of vaccines. Ensuring equitable access to vaccines globally is imperative to control the spread of infectious diseases. The Spanish flu pandemic of 1918-1919 was a catastrophic event that shaped the course of history and taught humanity invaluable lessons. The echoes of that time resonate in our current reality, emphasizing the need for preparedness, cooperation, and investment in healthcare infrastructure. As we confront the challenges of the 21st century, the experiences and lessons of the past continue to guide us in our efforts to safeguard global health and well-being. Thank you for joining us on this historical journey through the Spanish flu pandemic. May we carry forward the knowledge gained and work collectively to build a healthier and more resilient future. Stay informed, stay vigilant, and stay safe.